John Malanca here with the Association of Cannabis Specialists. And I'm proud and honored to be part of Dr. Jordan Tishler's board and team. And so, Jordan, good to see you.
It's great to be seen. How are you?
Always great to be seen. Doing well. And so, I joined your organization probably about 6 months ago, and we're coming up with some great topics. But the reason we're doing this casual conversation with Dr. Jordan Tishler, myself, and we'll also have regular guests, is just to educate not only the consumers, the patients, but most importantly, the doctors. Dr. Jordan is a Harvard-trained doctor, a medical professional, and who is an expert not only in his field of in his medical practice, but also has taken his expertise and brought it to the cannabis industry, which is definitely needed. And with that, hopefully bringing the stigma down and also paving the way for other fellow physicians, not only in the Boston, Massachusetts area in Harvard, and of course in Harvard Medical, but also throughout other top organizations and universities that want to get this information and education on the benefits of this plant, and again, bringing the stigma down. The topic, I always share with patients, families, and doctors that the topic of cannabis, because it is illegal in some states, doesn't mean that it's illegal to have these conversations with your patients. And so please know it's not a one-size-fits-all. And we're here today to talk about dosing and what to expect, not only if your patient is asking you about cannabis and the cannabinoid system, but what you as the physician and being that medical professional can offer to your patients with confidence. And so, Jordan, if you want to add to that, please.
I think you said, a great mouthful there. We've got to make sure that there are kind of two groups of physicians out there that we need to address. There's people who, like myself, are practicing cannabis medicine, and we need to be able to address those folks and make sure that they understand the evidence that we have, make sure they understand the areas where we don't have adequate evidence, but really bring everybody up to speed, make sure that they feel confident in their practice and taking care of complex patients with this complex medicine. That's one group. And then the other group, which is obviously the much larger group, is the group of physicians and medical professionals at large who aren't necessarily going to do this kind of medicine, but they're the ones seeing these patients first. They're seeing Mrs. So-and-so with back pain, or young Mrs. something else who's got, a new diagnosis of cancer. And they need to understand that cannabis as a medicine is a viable treatment for these sorts of problems. And they then need to know where their, resources are so that they can refer their patients to somebody that they can trust, and that person becomes part of the care team. And we have that kind of ongoing relationship, not only just with the patient, but with the whole team, so that everybody is on the same page that way.
I've been in this industry for about coming on 11 and a half, 12 years right now. And over the years, I've met a lot of doctors, not only here in the US, but overseas as well. And many of them, I said, how did you get into the practice of being, also use your example of a Harvard medical practice, a doctor, because I'm certain you didn't learn about the endocannabinoid system and cannabinoids in medical school, did you? Because it's a rarity that many doctors have.
It hadn't been invented. I'm that old.
Well, the cavemen were involved with us, so I don't think you're that old.
Well, let me rephrase and say it really hadn't been discovered at that point.
Yeah.
And so there was no discussion. I don't recall any discussion of cannabis pro or con in medical school.
Yeah.
So.
Yeah. But it's funny, one of the common denominators with many of these medical professionals shared with me was I started having so many patients coming in here and educating me as a doctor about the benefits of cannabis. And I applaud those doctors that they thought outside the box and said, you know what, this may be another option. And you and I both have the same mindset that cannabis is not a one-size-fits-all, first off, and it's not for everyone. And so we're not here to share with you that this is, and I use this term all the time, like the Willy Wonka golden ticket, and take this and you'll be healed. I'll never use the word cure, but healed. There's so many benefits of the cannabis plant. with 160 plus different cannabinoids, each playing a role in bringing the body back to homeostasis and helping, but educating. But the topic that Dr. Tishler and I want to discuss today for you is dosing. I wish it was at the point where, remember the old Tylenol commercial, you and I are this old, where it says, take 2 Tylenol, call me in the morning, and basically your headache would be gone. Cannabis, hopefully it'll get that way, but because it's not a one size fits all, doctors and medical professionals should look at age, weight, current health condition, any other medications, the sensitivities, as well as other, if it's something as severe as cancer, what stages, and what other modalities your patients may be using for healing. And so back to the drug-to-drug interactions, it's important to see, but even at minute amounts, we're all different. I might have benefits of 2 milligrams where you may have benefits of 25 milligrams. And so you're going to say something, sorry.
Well, I was just going to say, in some ways in the cannabis space, what you're saying now gets treated as though it were different from in the regular medical space. And I think that that's perhaps a misunderstanding on the general public's point of view, which is to say that we have, all of our conventional medicines have sort of general guidelines, starting doses, ending doses where we know that they're not going to be helpful above that range, or worse yet, they might be toxic above that range. But the idea of really any medicine is that we have a general idea of where to start and what it should do and what its risks and benefits and side effects may be. And then we use that medicine and we talk to our patient and we see, how did it work? And maybe if it's a medicine that's to treat a symptom, they can say, oh yeah, my symptom is better, or no, it's not working. And so we'll increase the dose. Oftentimes the medicines we give are for things that don't have symptoms, like high blood pressure, right? Where then we have to do a series of tests over time to see whether we're getting the benefit that we want. But this idea of titration to an individual's personal response is not as foreign to physicians as I think the world thinks it is, or thinks that cannabis is unique in that way. And so, when I think about dosing, there's sort of a 3 pieces of that equation that I think about, and to your point, I think about them in the context of that individual patient's condition. So, one is the actual dose. How many milligrams of the THC component am I recommending? The second is timing. What time of day and how many times a day should the patient take this stuff? And then the third component, which is I think a little bit more unusual, is what is the methodology of their taking it? And I don't know that people outside of the cannabis space understand it in the same way, that cannabis behaves differently depending on how we take it. And so that the behavior for inhaled cannabis is different from orally ingested cannabis. In fact, it really isn't that different from, again, the many other medicines, in that we know that, say, a beta blocker medication that's given by mouth behaves differently than if we give it IV. And in the emergency department, we often give those medicines IV because we want it to work right now while somebody's going 130 miles an hour, or beats per minute. We need to break that and bring it down into normal sinus rhythm quickly. And so if we give them a tablet of low pressure, we know that that's really just not going to be what we need at that time. And similarly, inhaled cannabis has rapid onset, but very short duration. So it's great for episodic and acute problems like a migraine type headache, where an edible, which as you know is very slow to work, is going to be useless. But the flip side is that the edibles are kind of our long-acting forms. So they're slow to work, but they work longer. And so for general sort of chronic pain management, we know that those long-acting forms are more successful than using the short-acting stuff, which kind of bounces people up and down all day and actually can make things worse. So you're right, there are many factors that go into thinking about this. But in terms of the dose range, and this is, I think, something that would surprise many of our cannabis-oriented folk, I think in terms of sort of 5 milligrams to 20 milligrams. Yes, I have a few patients who are doing well at sort of somewhere between 0 and 5. And I do have a few who are above 20, but those are the outliers, you know. And then what I would say is on average, again, regardless of whether it's inhaled or oral, 10 milligrams is kind of average. And then there's kind of bell-shaped distribution on either side of that. So if somebody comes to me and they say, well, doc, I've been smoking weed, and I use that term deliberately, slightly facetiously, you know, for 20 years, and now I have a, you know, back pain all the time, and I've started up myself on these gummies and I'm not getting what I need, and I'm taking 50 or 100 milligrams, that's already a red flag for me. That tells me that through their previous actions and their sort of slightly more recreational focus, that they have already developed a tolerance that is above what's necessary and above what's likely to be good for their long-term neurologic health. So then then it becomes much more complicated to try to bring them down into that therapeutic range.
So for your the fellow physicians that are listening to this right now, that are eager to learn and helping patients, you know, where would they start? The purpose of the Association of Cannabis Specialists that you were the founding, I'll say founding father of, you know, the purpose was to help educate, because, you know, the last thing you want as a physician, and I see this across the board here in California, all the way to where you are in Massachusetts, the unfortunate majority of doctors will just say, go down to the dispensary. And I truly believe that a medical professional should be involved for those reasons. And being able to go down, like you said, about heart medicine or any other medications that may be out there as well. So for the physicians that are listening right now, can you kind of give a little, I guess, an outline or a preface on how you became a Harvard Medical trained doctor and now a true cannabis specialist in our industry and beyond?
Well, you know, I got into this because having worked as an emergency room physician for the VA for 15 years, I saw veterans who were really harmed by substances, but really what I mean is alcohol is the 1 through 9 on that top 10 list. And it was then, you know, as we started to talk about cannabis as a medicine, you know, in the state, I sort of thought, you know, I've never really seen anybody sick from cannabis. So if there maybe is something to this medicine, then I should learn something about it. And that got me into reading the primary data. And, you know, to cut a very long story short, I became educated by really diving in, and it took many years for me to kind of digest and synthesize what I was reading. My goal with the ACS is to provide physicians and other healthcare professionals a distillate, you know, the answers in a more ready form. And, you know, to your point and question, the ACS provides that in a range of forms. So we're something like this, where we're just kind of talking in very general and casual terms about dosing, is certainly, you know, a toe in the water. We have a whole bunch of these sort of one-off conversation or little lectures that are available on the website. Some are available to everybody, some are available to members. But then, you know, the deeper stuff that's available specifically to members includes things like the handbooks. So when we were training back before everyone had a computer in their pocket, we used to carry these little spiral bound books that, you know, had the how-to. It wasn't a lot of theory. It wasn't a lot of explanation. It was like, all right, this is how you dose potassium IV, right? And so we have one of those which says, look, if you're sitting with a patient who has this problem, this is how you think about it, and this is what you send them home with. So we have that kind of a resource. We have what we call the clinical reference library, which is a compendium of not every study that was ever written, but rather sort of the top 3 best summaries in each field. So if you want to look up multiple sclerosis or ALS or anxiety, then there are sort of 2 to 3 key articles there for you to get your feet wet with. And then that we also have some educational products, meaning courses. So there's one that has a very long name. We tend to call it the 1.0, and that's a 20-hour course that starts with, this is what the plant is, and it ends up with, this is how you best set up your practice. And in between, we talk about why this works and what is the endocannabinoid system and what are the illnesses you can treat and how do you treat them. What are the special factors that you have to think about with children, with geriatrics? What are the contraindications, to your earlier point? What are the drug-drug interactions? Which components of cannabis do we have to worry about, namely CBD, much more so than THC? So really the point of that course is to take somebody who is interested and get them ready to sit down with a patient so that they can feel confident. And it's a very comprehensive course.
You know, you mentioned a portion about confidence, and that's the part that many of the doctors and physicians that I work with, they said, you know, how do I get to the point where I need to learn more about this plant? And so what the ACS and the reason you started this organization was for your fellow physicians that did have questions that might be on the ledge of, do I do this? And what about jeopardizing? Reputation's huge nowadays. And then because there's a stigma, and I remember when we started United Patient Group in 2011, thinking, one, how do I tell my parents? you know, and my dad passed a year prior, so he didn't. So basically, how do I tell my mom? You know, but California was, you know, it's been legal since 1996, so the stigma was there, but it wasn't as high as it is, you know, throughout the country, and it's slowly getting down. We were seeing, you know, I keep on saying Harvard trained. The closest I came to Harvard was my grandfather was a Harvard business graduate. So we have the red H at my folks' house. But it was, I'll give you a perfect example for him. He was a world traveled businessman, did extremely well. And in San Francisco in 1985, he was on his, unfortunately, deathbed with colon cancer. And I remember his doctor said, I would like you to try marijuana. And he looked at him and he said, are you out of your mind? I've been against drugs my whole life, and I'm on my deathbed now. You want to give me, you know, marijuana is how they pronounce it then.
Oh, yeah.
Dope. No, you're out of your mind. Give me some pain, you know, give me some more morphine type of thing. But I remember my mother shared that with me. And I said, God, who is that doctor? She said, I don't know. And I said, that doctor was ahead of his or her time. And so, you know, I applaud doctors that think and look outside the box, because ailments don't discriminate. You know, you can be the healthiest person in the world, you can be the richest person in the world, you can have everything at your fingertips, and cancer doesn't discriminate. And but having an option is what I truly believe patients, not only here in the U.S. but globally, should have. If they want to try to eat, you know, cardboard box, because there's a study that shows cardboard box kills cancer cells, people will do it. And so for our listeners, you know, my wife, we started this because of my father-in-law was diagnosed with stage 4 lung cancer, metastasized to his brain. He was given weeks to live. We asked about medical cannabis for appetite stimulation, nothing else, not knowing the medical benefits. And the doctor said, good luck, you have a couple weeks. And with 3 milligrams, not knowing what we were doing, his appetite came back. And we said, great. His complexion came back and movement started riding. Next thing you know, he was on 24/7 oxygen. Day 8, he's shuffling around the house. 6 months hospice style with him as a patient. And then he was never going to get scanned. And then 9 months went and got scanned and came back no evidence of recurrent disease. So I've seen this plant work, and I've seen it not work. In 2017, my wife was diagnosed with pancreatic cancer, and that's someone who didn't drink, didn't smoke, worked out, stayed healthy. I called her Mary Poppins, and we tried everything. And when you get that diagnosis, you're thinking, oh my goodness, we will try anything and everything. And we did. We consulted with doctors, not only here in the cannabis industry, but beyond. Australia, New Zealand, Italy, UK, Mexico. You try different modalities. And I think having an option is what I was getting at. In cannabis may work for some, may not work for others, but at least they have an option. And having a well-trained and educated team behind you with confidence is exactly what you, Jordan, and for our listener, Dr. Tishler's not only doing for his practice, but what the goal is to help other physicians feel confident in working with their patients as well. And so what are the steps that you would share with your fellow physicians if they're interested in coming into this industry saying, help, where do I start, Dr. Tishler?
I think that the first place to start is to understand that cannabis is a medicine and that it should be treated really pretty much like all the other medicines that we use. There are minor things about it that are a little different insofar as, for example, if we have a patient who's using this by inhalation, that there are ways we can figure out their dose, but they just require a little bit more gymnastics than our standard tablets. Certainly using edibles when they're appropriate makes the dosing just a little bit more transparent. But the bottom line here is this is, again, why the ACS exists. And I would recommend that anybody thinking about this join the ACS. It's not terribly expensive. And not only do you then get access to all of those educational options, but one of the things that I hadn't mentioned when I was rattling on about our benefits is we have mentoring. So we have once a month groups where clinicians get together and we talk about, it's just kind of like morning report. We get together and we talk about the cases that we've seen, talk about the particulars that made it difficult. What should we do here? What risks do this pose? And so, we can really learn from each other in terms of experience, and we can bring the data to bear in specific cases. And I think that not only is it really helpful, but at least for me, I find it really enjoyable way of engaging with my colleagues on this subject. So I highly recommend.
And of course, also, and I love that mentoring, mirroring type of opportunity that you are offering, and other physicians have taken advantage of. So I applaud you for that. But also accreditation, offering CME PRA Category 1 accreditation for medical professionals to take these courses as well. How do they find you?
The best way to do this is to come right to our website, which is cannabis-specialist.org. I'll say that again, cannabis-specialist.org. It's a bit of a mouthful, but once you type it in, you'll find us. And there's a wealth of information that's right there freely available, including a little video of myself talking about why you should join and all that stuff.
Yeah.
But, I think that joining provides you lots of access to really helpful things. And if nothing else, that mentoring and access to me and to board members who have been doing this for a long time, hopefully provides the kind of support that people need in order to get started.
Yeah. Before we go, speaking about dosing and the types of different options out there, and I use cannabis as medicine, but safety issues and what to look at, and we can touch up on this, and we can take this as another topic of a casual conversation as well. But what to look out for, and there's so many different products out there. And the one thing that Dr. Tishler and I would recommend is look for a product that's tested. It's not up to you, the physician or your patient, to go down and get a tested product. Or, excuse me, we're going to have the dispensaries, if you want to say. Let me back up there. Apologize there. It's not up to you, the doctor, or the patient to make sure to go out and get the product tested. It's up for the dispensary, or who the legal organization that's selling you the product. They should have test results, QR codes nowadays. Regulations have changed, but making sure there's no mold, pesticides, fecal matter, and you say fecal matter, yes, but just different, harmful elements in this product. And so there's so many different things to look at. And so we'll pick that up in another casual conversation. But please note, it's not a one size fits all, and not all products are created the same. And so there's some safety things to look at. But another part of being part of the ACS and listening to what Dr. Tishler and team can share with you, the curious or the experts. So we'd love to have you join. It's a great organization with some great opportunities, but with like-minded people as well. And you want to add anything to that, Dr. Tishler?
No, I think that you've summarized it really well, and we look forward to our listeners continuing this journey with us in our future casual conversations.
Fantastic. And so this is Dr. Tishler with the Association of Cannabis Specialists, and John Malanca as a board member also for the Association of Cannabis Specialists. We'll see you on our next casual conversation with Dr. Tishler, John Malanca, and any of our other guests that join. So wishing you all a wonderful day, and we'll see you soon. Thank you.